This video will cover premenstrual dysphoric disorder, a lot of times known in the medical field as PDD. Premenstrual dysphoric disorder is a brand new diagnosis in the DSM-5. Um, it was not previously considered a mental health diagnosis because of the menstrual connection, and it was better explained by medical causes. Of course, that makes a lot of sense. So when a client experiences these symptoms and it's obviously related to their menstrual cycle, clients typically go to a medical doctor, um, more specifically a gynecologist, to figure out what's going on and how to feel better. But occasionally, the doctors would prescribe medication and the symptoms still would not get completely better. So doctors began to refer these clients with a diagnosis of premenstrual dysphoric disorder to mental health professionals. And a problem with that is well, we don't have a diagnosis for premenstrual dysphoric disorder. Until now, we didn't have a diagnosis. So when the client would come to us, we could not diagnose, or we couldn't diagnose with premenstrual dysphoric disorder. We could not send that diagnosis to insurance because insurance was saying, hey, wait a minute, you can't treat premenstrual dysphoric disorder. That's a medical condition. That's not listed in your DSM. So, in order to see clients with premenstrual dysphoric disorder, these clients were getting diagnosed with major depressive disorder, persistent depressive disorder, or actually dysthymic disorder, because in the DSM-4 TR, that's what it was called, and even worse, bipolar disorder, because of the mood swings that come along with premenstrual dysphoric disorder. So, the DSM-5 committee made the decision to just put it straight up into the DSM-5. So, when clients came, when referred by their doctor or when they chose to receive counseling for this disorder, we had something to diagnose that was not offensive to the person, and it was just accurate for what the client was experiencing. When I go over this disorder with clients, some do find it offensive, or not with clients, I'm sorry, with students. Some do find it offensive that premenstrual dysphoric disorder is in the DSM because it makes it seem like these premenstrual and menstrual symptoms, mental health symptoms, are crazy. That any woman who experiences these symptoms must be crazy because the DSM now tells us it's abnormal to feel these symptoms. And one thing that I want to stress is in absolutely no way is experiencing these symptoms during the menstrual cycle and prior to the menstrual cycle in any way something that would make you crazy. And even if it is to the point of being diagnosed, it's still not crazy. It's just abnormal and it's something that needs treatment. So it's very common for ladies to experience any or all of these symptoms during this premenstrual and menstrual cycle. What makes it abnormal and what makes it a disorder is when you experience these symptoms to the point where it's interfering with your functioning. So maybe you have to call in at work and not go to work that week because you're experiencing these symptoms to such a high level that you can't function at work. Maybe you're not spending time with your family. Maybe you're having to stay in bed for the days when you're experiencing these symptoms. If you're able to experience these symptoms and function occupationally, educationally, socially, then this is not something that you would be diagnosed with. They are symptoms that are frustrating and aggravating, but until you experience them to the point of not being functional, it is not a disorder. So I'm sure that most of us will have some stories or, eyes get big when you hear some of these symptoms because you'll be able to relate. But again, it's not that you have this disorder unless it causes you to be dysfunctional during the times of the premenstrual symptoms. And I'm going to go ahead and apologize in advance to Mr. Cox for having to listen. And I would say this is one of those times when being in an online class has a definite pro, because oftentimes when I teach this class in diagnosis, there may be one or two men in a classroom full of 20, 25 women, and it gets a little, the conversation gets a little sensitive, and sometimes the cheeks get red. So I'm glad this is an online class for you. Okay, if we look on page 171 in the DSM-5, And you'll see that the diagnostic criteria goes on to page 172 as well. And many of the symptoms are listed pretty much word for word from the DSM-5 here on the next 3 slides of the PowerPoint. So if we look at part A, first of all, let's get a lay of the land here. If you look on page 172, you'll note there are no subtypes, there are no specifiers. So when we diagnose with premenstrual dysphoric disorder, we will use the code N94.3, premenstrual dysphoric disorder. Now, you've probably already noticed a difference between the code numbers for premenstrual dysphoric disorder and all of the other disorders we've talked about. Most mental health codes begin with the letter F. This code, however, begins with the letter N, and that's because this is primarily a medical diagnosis. We're actually just carrying over the medical diagnosis and treating it as a part of the treatment that a medical clinician would. So we're not saying that premenstrual, this is another sign that we are not saying that premenstrual dysphoric disorder is a mental health disorder. We're saying that this is a medical condition that may benefit from some counseling. Okay, so now that we have the lay of the land, part A, in the majority of menstrual cycles, at least 5 symptoms must be present in the final week before the onset of menses, start to improve within a few days after the onset of menses, and become minimal or absent in the week post-menses. Now, typically, a woman's menstrual period is on average 5 to 7 days. Many women have shorter periods, many women have longer periods, but on average 5 to 7 days. So what this would say is we can only count symptoms toward this disorder if they occur in the final week before menses, so the 7 days prior to the first day of the menstrual cycle, and we can only count the symptoms if the symptoms begin to improve within the first few days after the onset of menses. So day 1 of your period, the symptoms are probably severe. Day 2, they get a little better. Day 3, they get even more better. Even more better? Day 4, they're even better. And by the end of the period, they're pretty much gone. So, and that's what the last part says. They become minimal or absent in a week post-menses. Okay, so if we add all that time up, 7 days at the beginning is qualified, an average of 7 days of the period, an average of 7 days after, my goodness, that's 21 days out of the month. And most women have a 28-day cycle. They do this every 28 days, or that's the average. Many women don't do 28 days, but on average 28 days. So if we're having these symptoms possibly 21 days out of 28 days, we get one good week, ladies. One good week where we don't have these symptoms. And so that's what lets us know that it's premenstrual dysphoric disorder. These symptoms occur like that, like clockwork, around the menstrual period. And there are a few days in the month in between that first week beginning and first week post that we feel like normal human beings. Okay, so if we look again, you have to have at least 5 symptoms out of Part B and Part C on page 172. So there are 11 possible symptoms, and we have to have at least 5 symptoms out of those 11. Now, there's one more bit of criteria. If you look at the directions for Part B, it says one or more of the following has to be present. If you look at Part C, one or more of the following has to be present. So you have to have at least one symptom from each section, but out of both sections, you need a total of 5. So 2 can come from the first and 3 from the second, 1 from the first, 4 from the second. However the order, it doesn't matter, as long as at least 1 comes from both sections and there's at least 5 symptoms out of 11 total. So let's look at these symptoms and let's talk about them. And I'm going to apologize in advance because, I talk about these symptoms kind of lightly, but I do know that they are they can be very severe and they are very frustrating. So I don't consider them lightly, but sometimes it's easier to talk about them lightly. So let's go ahead and talk about the first, a marked affective lability. Some call it lability, but I've always been taught it's a labile mood, and so lability makes more sense to me. But these are mood swings. Most of you have had your theories courses. You know what the word affective means? It means dealing with mood. So, and an affective lability means having shifts in mood, so mood swings or mood shifts. And think about this when thinking about your own menstrual cycles. That's a very common thing. Being moody, it's what menstrual cycles are known for. Moody women. So that doesn't make uh, much confusion when we think that premenstrual dysphoric disorder would include some mood swings. However, mood swings are common, and I want to throw in that plug again that just because you have mood swings during menstrual cycles does not mean that you have premenstrual dysphoric disorder. It has to cause problems with functioning at work, school, home, socially, whatever setting. Okay, number two, um, marked irritability or anger or increased interpersonal conflicts. You find it really hard to get along with people that you usually get along with. Um, it's easy for me to understand this by thinking about my relationship with my husband. There are times when that man gets on my last ever loving nerve when I'm experiencing a menstrual cycle. Um, I don't know why. It's something magical about that time that makes everything just hard to deal with. But little things like bathroom towels being on the floor instead of on the rack, clothes being in the floor next to the hamper instead of being put in the hamper. Shoes not being in the basket, but being right beside the basket in the entryway to the house. 3 weeks out of the month, that does not bother me one bit. But somehow, during that 1 week, it's just more than I can take. Easily irritated, um, very much so. Again, it's not a disorder until it interferes with your functioning and interferes with your interpersonal relationships. So a lot of times my husband never knows that those things aggravate me to death because I have enough awareness to know that I'm really only aggravated because this is going on. Because every day, not just those 7 days, but every day, the bathroom towels are in the floor, the shoes are not in the basket, the clothes are not in the hamper. And it doesn't bother me a bit because odds are my clothes are right there with him, and my towels are right there with him, and my shoes are laying right beside of his, not in the basket. So as long as you have that awareness that it's going to go away, I'm not going to be irritable forever, it's a much prettier world. Okay, number three, marked depressed mood, feelings of hopelessness, or self-deprecating thoughts. And this is one of the reasons why premenstrual dysphoric disorder was placed into the depressive category. That's another common question by students. Why is this considered a depressive category? Well, first of all, I can't think of a better place to put it. But there is a large component of depression. It's very common, and here on number three in Part B, we see that it is a symptom that those feelings of hopelessness, the depressed mood, the self-deprecating thoughts. However, if you look at number four, market anxiety, tension, and/or feelings of being keyed up or on edge. So here comes the question: why is it in the depressive categories and not the anxiety categories? And while I don't have an actual answer, I was not on the DSM-5 committee, I would say that what makes sense to me is depression is much more common than anxiety. You don't have to have both. And also, when looking at the medications that are used to treat premenstrual dysphoric disorder, it is antidepressants that are the number one go-to medication. So, because the disorder responds the best to antidepressants, it makes sense to put them in the depressive disorder category. Okay, if we look at Part C, um, number one, decreased interest in usual activities. And if you have watched the major depressive disorder video, you have probably already learned what my favorite clinical word is, anhedonia. And this is anhedonia, when a person has decreased interest in activities that they usually found pleasurable. Um, that happens quite a bit in premenstrual dysphoric disorder. Um, Women, we don't want to go swimming. We don't want to exercise. We don't want to do much except eat chocolate and sit on the couch and watch Lifetime movies. And that's better explained in the following symptoms. But you just don't feel like doing things that you used to find pleasurable. You feel bloated, you feel tired, um, you don't feel pretty. It's just an overwhelming sense of lower self-esteem almost, and then anhedonia mixed in. You just don't feel like doing things that you used to find pleasurable. Number two, difficulty concentrating. Um, this goes along with the anxiety symptoms. So those who have difficulty concentrating are more likely to experience from the category B, um, depression and anxiety symptoms. So it's like you're almost too tired to make a decision. So all of these options pile up in your mind, and it's really hard to sift through all of those options. Or you think about the to do list that you have and all of these things that you need to get done today, but you're so tired and you're so lethargic and you're so fatigued that you just can't make a decision. You just don't want to do anything, so you choose to do nothing. And so all these things pile up, and you just have trouble concentrating. Sometimes you even struggle with following a conversation because the ability to concentrate is just so difficult. Number three, lethargy, feeling lethargic, easily fatigability, easy fatigability, so feeling fatigued, and a marked lack of energy. This is where the wanting to lay on the couch all day and watch Lifetime movies come into play. It's easy to concentrate on a Lifetime movie because there's not a whole lot of plot in those things, and you're just tired. If you think back to the symptoms of depression, and the psychomotor retardation, where your limbs feel so heavy, you just don't feel right during this time when you're experiencing premenstrual dysphoric disorder. Your limbs feel heavy. You don't feel like you have energy to do anything except sit on the couch. Um, Number four, a marked change in appetite, overeating, or specific food cravings. This is where the chocolate comes in. I don't know the medical reason for craving chocolate, but I get it. And I know that, and then I can't eat it because chocolate causes migraines for me. So it's really painful to want chocolate and not eat chocolate. Um, I've given a poll in previous classes just to see what the common or food cravings are during this time, and ice cream is really big. Anything sweet and anything salty. Now, those are very common things. Pizza, anything really fatty. Um, yeah, so it's kind of common among women, but I'm sure that there's some women that prefer different foods during that time. Number five, hypersomnia and insomnia. We talked about that in great detail in major depressive disorder, so I won't go into that much here. Number six, a sense of being overwhelmed or out of control. That goes along with the difficulty concentrating and the anxiety. And then number seven, physical symptoms such as breast tenderness, swelling, joint or muscle pain, bloating, and weight gain. And we mentioned some of those as reasons for the decreased interest in usual activities, but a lot of that comes along with menstrual cycles. Okay, so there is some more information um, to know about premenstrual dysphoric disorder to kind of put it into perspective. You've probably heard of PMS, premenstrual syndrome. Premenstrual syndrome only occurs prior to the menstrual cycle. It doesn't take any consideration into during the menstrual cycle or the first few days before the menstrual cycle. So, premenstrual syndrome, PMS, occurs a few days before the menstrual cycle, not immediately, but 5 to 11 days before the menstrual cycle. So this almost covers the rest of the month that's not covered with premenstrual dysphoric disorder. Um, Premenstrual syndrome has always confused me a little bit because when you think about premenstrual dysphoric disorder, that would cover every other day of the month besides days 5 to 11 prior to the menstrual cycle. So I've just never really understood how days 5 to 11 before the menstrual cycle can be counted as a menstrual issue. But again, I'm not a medical doctor. I'm one of those talking doctors, as my nephew calls. So I'm sure there's a connection there, but I struggle with it. Premenstrual dysphoric disorder makes much more sense to me. The second bullet, PMDD, occurs in 3 to 8% of the female population with menstrual cycles. Now, there are 19 females in this class. I'm sure that going through these descriptions of premenstrual dysphoric disorder, these symptoms, there's probably been some head shaking, some nodding, some, oh man, I do just that. That describes me to a T. Every woman, every female within a menstrual cycle developmental period will feel like they have these symptoms. But it's important to note only 3 to 8% will actually be diagnosed with this disorder, because while most ladies in this developmental period experience these symptoms, only 3 to 8% experience them to such a high degree that it interferes with their functioning. And then last, we've mentioned this, but medication interventions for premenstrual dysphoric disorder are antidepressants to help with the mood and birth control pills to regulate the cycles, to keep them from being too heavy and too severe. However, there are many women who cannot take birth control pills for multiple reasons, religious reasons, and also for a history of high blood pressure. Any client with a history of high blood pressure should not be taking birth control pills. It can be very dangerous. Levels of estrogen, or anything with estrogen, any kind of birth control method with estrogen causes a dangerously high increase in blood pressure for those who already have a history of high blood pressure. Okay, so that's premenstrual dysphoric disorder.